So in the summit rounds this morning, we talked about mentorship. And Brian, you mentioned people that have mentored you in your career. Could you talk a little bit about what impact they had, who they were, what they did for you?
Yeah, I think when you're going through the training process, you're really caught up in the data. You're caught up in the science, you're caught up in how to become whatever it is that you're learning to become. And I think at the time, that's what I thought the value really was. I really, appreciated the information, and the example and the technical skills and all of those things that I learned. I think as time goes on, as you get farther in training, you start to appreciate the more subtle things. I think where I sit today, 5 years or so, kind of from leaving that type of an environment, I think I appreciate more who they were as people and kind of the way they helped form, me as an individual. I think their patience with me, their even though I didn't recognize it at the time, the things they were trying to teach me that were a lot deeper than just the science and the knowledge and the facts. And so they were good individuals, they were good humans, they were good people, and I really didn't appreciate that as well early on, like I do now. And I think at the heart of any good mentor-mentee kind of relationship, if you don't have that kind of respect for the other person as an individual, then it's going to be a harder and a much less fulfilling kind of process.
Who in your training do you feel had the greatest impact as a mentor?
Yeah, that's tough because they all brought so many different things, So when it comes to kind of the business of healthcare and pushing me to explore that, even when it's not necessarily something physicians are encouraged to do, I think Robert Harbaugh probably was. Because of his role, he was able to facilitate that. I think many people would not have recognized the value and wouldn't have seen that that was good dollars for the university to spend on me to get that kind of education. But he did. He recognized that and encouraged it and really promoted it. And so that was huge. I think the less is more kind of techniques, understanding that bigger isn't always better. As a resident, you want to do all these big, fancy, crazy surgeries. And I think my appreciation for the simple and what truly is going to actually address the patient's issue, not an image, but the actual patient. I think Tim Ryder was a big part of that and helped me see that. But there's just so many that helped me in different ways. And I think that's the advantage of having a lot of mentors, is that they all, you can learn from the best of each of them. And I would say I feel like I'm a conglomerate of probably 14 or 15 different mentors that have been a huge role in my life.
What have you enjoyed at this stage of your career in helping to mentor others?
Yeah, the excitement, when a student comes up and they're just so energetic and so motivated and, excited to write the paper that just would not be pleasant for me, that I'm just kind of not, I just don't have the bandwidth for right now. They're so excited about it, and that energy just reminds me of where I've been, where I came from. Because sometimes we forget that, and they just want to do, they're just so eager to learn, they just want to do the best that they can. They want to be successful, and it just kind of is a reminder of those experiences that I had when I was in that situation. And it makes me a little bit more optimistic on where things are going in the future. Sometimes it's easy to be pessimistic and think, boy, things are just so bad. How are they going to ever get better? And when you have a room full of students, you kind of realize there's a lot of people with a lot of energy that are ready to take this on.
I'm grateful you share my enthusiasm for mentorship. We have 30 plus students that work in our office. Many of them are headed or hope to go to medical school. Some of them are planning on going to PA school or nursing school. And it's been really fun to work with them. And I think we have 15 that are currently in medical school that have worked with us in the last couple of years, and probably another 15 or so that are headed to medical school this fall, which is exciting. And it's been it's good to work with other surgeons and other people in the practice that share that enthusiasm for mentorship and recognize that all of us got to where we are by some of our own effort, but also by the efforts that others invested in us. And so there's sort of this idea that you're passing that along.
I understand. It's definitely a legacy. And the farther along you get in your own career, the more you appreciate that. And you start thinking about these things. The impact, and I say this all the time, but the impact that you can have by educating some other individual to provide care, provide service, or otherwise change, their own patients is way more than I can impact by touching them myself physically, doing surgery on them or anything else. I can only physically see and operate on so many people. But if you train a handful of others and you help them help others, your impact will go so much farther. And so I really do see it as being part of a much bigger kind of web that expands out. And the way for me to have the biggest catchment or the biggest impact is by not necessarily taking care of patients, but helping promote the field and good care and perpetuating good medicine to other providers who are then going to impact countless others, and so on and so on.
Yeah, it's nice to be immersed in all of it, really, and I appreciate you presenting today and the perspective that you bring to the table, and it was a really good conversation, so thank you.
No problem. Happy to help.